Memorial Day weekend is the unofficial start to summer, and families, maybe you're heading up north or getting a cookout or just going outside.
Warmer weather as we get into summer can come with risks for kids, and well, the pandemic is still not behind us, even though it may feel like things are back to normal for a lot of us. Here to help us have a fun and safe summer is Dr. Anupam Kharbanda, the Chief of Critical Care at Children's Minnesota. Dr. Kharbanda, thanks for being here.
Thank you.
Why don't we start with COVID? I know, I will say just anecdotally, I feel like there are as many people who I know personally who have COVID now that did around Christmas time when everybody was on alert for it. So where are we at, and how should families sort of factor COVID into their Memorial Day weekend plans?
You know, COVID is quite widespread right now. Our hospitalization rates in the state have risen over the past 8 weeks. Not to dangerous levels, but they've certainly doubled since the beginning of April. We've also seen patients coming into the emergency department and hospitalized at Children's with COVID-like symptoms as well as positive cases. I think the main thing for people to realize is that the treatment of vaccination or the prevention through vaccination is highly effective at preventing not only an ED visit, but also hospitalization. And so I would encourage all families to get a booster if they're eligible. Those kids who are 5 to 11 now are eligible for a booster. And we know from national data as well as state data, and our state is at the forefront of tracking COVID-based illnesses, that vaccinations are very highly effective at preventing severe outcomes. You're still going to have breakthrough infections. And that's just like any year with influenza. And we shouldn't be worried about breakthrough as much as the severe disease. So I would encourage people, even if you know someone who got it, it doesn't mean the vaccine didn't work. The vaccine worked to prevent a hospitalization or death, and that's what it's intended to do.
Dr. Kharbanda, I know last summer we seemed to report on a lot of drownings of kids. What are some reminders that you have for families when it comes to the water?
So drowning is a major cause of illness in kids and death. It's the #1 cause of unintentional injuries in children under the age of 5. And I would remind families that there's two big sort of bell curves here, under age 5 and then the adolescents. Under age 5, it's all due to supervision, and it's at the home-based pools. That's where we see these injuries. So for those kids, supervision, making sure there's one adult identified as someone who can watch those kids, and making sure those kids get swim lessons. Those are key items. For the older adolescents who are out in canoes, on the water, a life jacket, making sure they've had swim lessons as well as supervision, almost like a designated driver or a designated boat driver, are key items. So 3 things: supervision, life jackets, swim lessons.
This weekend we expect a lot of people maybe have that backyard fire or the fire pit. What sort of safety measures with kids around that?
Again, a lot of this comes down to supervision. Sure. And I think people don't realize how quickly you can get a burn to a child's hand by them either deciding to jump over the fire or put a piece of food or a hot dog or a marshmallow into a fire pit. Those injuries can occur in less than 10 seconds. So creating a barrier, #1, to prevent the unintentional falling into these things. Second, reminding the kids of the danger. And third, really trying as much as possible to keep a close eye on them. And that sounds like practical piece of information, but that will cut down on the majority of the injuries.
Very good advice. We appreciate it. Dr. Kharbanda, thank you so much for being with us, Chief of Critical Care at Children's Minnesota.
Thank you so much.